Thank you for your interest in PerioPal software. This demonstration will provide you with an overview of PerioPal's features and functionality. If you would like more information, please join us in a web demonstration and learn what many dental practices have experienced with PerioPal's unique and efficient periodontal charting software.
Welcome to PerioPal.
PerioPal is voice-driven software for periodontal examinations. PerioPal is an improved method of hands-free recording that enables the user to record more data more accurately in a single pass and do it alone. PerioPal offers the complete tools to diagnose and educate patients, as well as motivate them to accept treatment. With PerioPal, voice really works. A complete and comprehensive exam can be recorded in an average of 5 minutes with 99% charting accuracy using PerioPal's commands. PerioPal's predefined commands give users the freedom to record data in any order. This means any clinical condition that matches a PerioPal command can be said in any order. I'm sure you will agree there are many problems inherent with the traditional periodontal exam. PerioPal's goal was to significantly solve these problems. Voice really works. Recent advances in voice technology promises to change the way we interact with computers in the future. Speech technology from decades past has had many limitations in a noisy clinical environment. Now voice command technology has been successfully engineered to solve the clinical challenges of traditional periodontal charting. Most speech-activated periodontal charting systems use speech dictation technology to control the verbal input of the exam. The big drawback of using a speech dictation system is that each word must be compared to thousands of words in a large vocabulary before it can be recognized. Voice dictation is designed for building text sentences and paragraphs. Voice command technology restricts the vocabulary to 200 chosen words, significantly improving accuracy and speed in word recognition. With PerioPal, there are fewer than 200 recognized words with any given screen. PerioPal was designed for voice input. Other voice-activated periodontal recording systems were designed for mouse and keyboard input, then modified to support voice activation. Every facet of PerioPal is designed to facilitate accurate and rapid data capture during the recording of a periodontal examination. Voice command technology is very well suited for periodontal examinations. Although the exams are tedious and data intense, there are relatively few words needed to report the patient's oral health. By limiting the number of words recognized, speed and accuracy increases. The design of PerioPal was motivated by the fact that there are no documented or standard periodontal abbreviations to accurately and efficiently report periodontal conditions from the oral cavity to the recording log. PerioPal's customized commands shorten the enrollment time of data, increase the accuracy of the exam, and decrease the tedious task of periodontal charting. PerioPal's abbreviation commands combine a numeric measurement with an abbreviated periodontal condition. Saying R2 means 2 millimeters of recession. For example, on tooth number 4, the patient displays a crown, 4 millimeters of probing depths, bleeding on probing, 2 millimeters recession at the central site, and plaque. You say crown, 4B2, 4B, R2, plaque. All oral conditions can be recorded as they are observed. Shortcut commands tell the program a certain way to chart the data. For example, the oral conditions on tooth number 5 match the conditions of the previous tooth number 4. You say repeat. The same data is recorded, charted, and stored as the program automatically advances. The shortcut commands that make the exam progress quickly are repeat, normal, good, pocket repeat, and margin repeat. The normal and good commands indicate that the distal, central, and mesial measurements are within the normal limits. By saying good and normal, the patient draws a clear distinction between what is health and what is disease, as well as preserving valuable time to precisely record areas of infection. With PerioPal, users can efficiently record more data in a much shorter amount of time. The Preferences screen allows the users to select numerical values from a computerized list that matches their criteria for a normal or good condition. With PerioPal, the proposed treatment feature enables the user to select probing depth criteria from a computerized list that matches the practice's periodontal protocol for therapy. If the selected value is recorded during the course of the exam, PerioPal automatically generates precise on-screen displays and report images highlighting the predetermined guideline for therapy. PerioPal offers the complete tools to diagnose and educate patients, as well as motivate them to accept treatment. If at any time during the exam you observe clinical elements that contribute to the periodontal condition, all you need to do is say sidebar. PerioPal's unique sidebar screen opens immediately, allowing you to verbally record 72 additional observations, such as recurring decay, root decay, restoration fracture, and other conditions that are observed as the exam occurs. You will use PerioPal's evaluation screen to gather and report exam findings. PerioPal gives clinicians a way to organize the healthcare needs of their patients by the use of the AAP classification system for periodontal diseases and conditions. PerioPal patients know their numbers. The verbal recording of a periodontal exam, combined with real-time viewing of charting data, provide patients with visual and tangible evidence of their periodontal health, disease, and needs. After the exam, the patient's current exam data is generated into 4 PDF reports, displaying a clear and concise diagnosis. Educational documentation is also available. In order to promote short and long-term motivation, it is important to take your patients back to a more infected state. PerioPal provides the mechanism to immediately and accurately note areas of disease activity and evaluate treatment outcomes. The reprobe option is similar to cruise control. When problem areas need to be re-examined, PerioPal automatically guides users to those areas by calling out the tooth number with abnormal probing depths based on a previously completed exam. The time is now for voice-activated exams. PerioPal is not the first voice-driven periodontal exam, but it may be the first that is truly usable. Charting usability and excellence is the base standard from which we seek to improve.